I have been getting mega heartburn for months now. Every single time I drink water, it started getting worse and worse. So I'm just eating. I took a nap. That's why I look the way I do. When I sleep, I swollen. I get a little bit. When I sleep, I get a little bit swollen. And worse. Like, it's happened to me for years. But in the last, like, 5 months or so, it's been bad. Especially because everything I'm eating since I got my wisdom tooth out formed. And that is what I was dealing with. There were nerves in it, and it was exposed, and it hurt so bad. So this is gross. Now I'm gonna go wash my hands, but that's the tooth that got taken out. Has had a lot of sodium in it. I am wearing the same thing I wore yesterday because I woke up and just threw it on because it was right next to the bed. But I am actually about to go to the ER. I only got about 4 hours of sleep, but really don't care. I noticed yesterday, I just feel like everything's falling apart. Like my whole body is just done, and I don't blame it. But yesterday I started noticing a pain slash little bit of, I guess you could call it maybe puffiness and hardness near my belly button. And my first instinct is hernia because it also kind of hurt. And I am bigger, so hernia is not gonna be shocking. And I was waking up in the middle of the night, and I just noticed every time I tried to sit up a little, the pain was a lot worse. And now every time I bend, it's a lot worse. So it really seems like
it's a hernia. I don't know. Normally I would just wait to go to my doctor or something, but I just feel like kind of scared because it could be something else. I'm not gonna sit here and diagnose myself, but that's what it sounds like.
And I'm pretty terrified, so I'm gonna go to the ER. I know there's not much besides surgery if it is a hernia, and obviously I'm too big for surgery. I look insane, but they did blood test, pee test. I might get an IV, so that's the update. Hey guys. So it's actually the next day, and I wanted to give you an update yesterday, but after I came back from the ER, Becky and I took a really long nap. After the nap, I just kind of tried to preoccupy my mind, and we played, some Mario Party, a couple card games. So at the ER yesterday, they took my blood, did my pee, and they found nothing. And the doctor I saw was just like so nonchalant about how much pain I'm in and where it's located. They literally sent me home. So I was like, okay, I'm just gonna, see my doctor. The only reason why I didn't wait is because yesterday was Saturday. Doctor's not open on Saturday. Today's Sunday. Doctor's not open today. I was like, okay, if the doctor's so nonchalant about the situation, literally sending me home without a diagnosis, maybe nothing's wrong. So I kind of just was enduring the pain and trying to ignore it. And I woke up today. Not only does it hurt a little bit worse, but now this is like TMI, but hi, Amberlynn is trying to be honest with you guys. My belly button is bleeding. And that's never happened to me before, and it could be like a million different things, but it's like, I'm gonna go back to the ER, and all of this is coming out of pocket, and it freaks me out because it's a lot of money. But I have come to the terms as of recently with like seeing a psychiatrist and going to the doctor and seeing a weight loss doctor. Like, my health is more important than money.
On the inside, we just have some cash flow. Like, oh god, there's hundreds in there. I hate flexing.
No, but my bank is rather annoying. There is a limit that how much I can spend in a day, and I've tried calling them and telling them, hey, I want to spend about $3,000. They're like, I'm not sure you can do that, and I'm like, Felicia, what? So I feel like my only option is to like pull off the money, find a Louis Vuitton store, and actually physically go to it. That's just how it is for me. So I am gonna go to a different ER. I hope that they'll help me with this because like obviously it's not getting better, it's getting worse. Like it'd be a little bit different if I woke up today and it was like better, or if it was just the same. I probably would just wait to schedule an appointment with my doctor because that's what I was gonna do. And now the fact that it's getting like worse freaks me out. So I'm gonna go to the ER. I don't want to. To me, this is an emergency. Yesterday when I was at the ER, they specifically told me, if you get any worse, come back. Well, I'm not going back to you, baby. I'm going somewhere else because I feel like if you go to the ER, you should, you know, get the test done. Hey guys, so I actually woke up a little bit ago and I kind of just wanted to talk about something that I have been experiencing the last few days, which this is not a normal for me. I've been experiencing a lot of heart palpitations, and with the mood stabilizer I'm taking, that's one of the symptoms that could happen, and that kind of freaks me out. So it's something I definitely need to talk to my psychiatrist about. And I'm now taking 100 milligrams of the mood stabilizer. When I started at 25, and then eventually I went to 50, and then eventually I went to 75. I feel like when I was on 50 and 75, I felt the best, and now that I'm on 100, I'm kind of like, I feel like I'm not doing the greatest anymore. So it's something else I need to talk to her about. But like the whole heart palpitation thing is starting to really freak me out, and it's like I get really bad anxiety. So when I start having heart palpitations, I get anxiety, and then it like makes it worse and I start freaking out. You know, maybe it's not from the mood stabilizer, maybe there's a deeper issue. So I think I'm gonna actually be seeing a heart doctor. I feel like that's very important, especially because, you know, at my weight and such. But a common side effect with this mood stabilizer is unfortunately heart palpitations. So I don't know what to do. Hello, so it's me in the future. So I actually figured out that it was caffeine causing the heart palpitations, so I haven't drank caffeine since, and everything is fine. So I'm glad I was able to figure that out. And I'm actually about to go to the hospital, to the ER, because that pain is still there in my back. Of course, it's nowhere near as bad as it was, but it's like a constant dull ache in my right lower back, kind of where you'd get some kidney pain. So I, for one, am worried, and I want to get that checked out or just see what the hospital says. It is midnight, so I'm going at a time where not a lot of people are usually there. So I'm gonna try my hardest not to take up anyone's time. I just know that if something is wrong with my kidneys, I better nip it in the butt now. But that's just where my head is going and where I'm worried. It could be a UTI. I've never had one before, so I don't know. So I'm just really nervous. So I just got my blood taken. Traumatizing. And I also had to pee in a cup. Cool. Okay, so I'm back home, which means I'm back on my camera. I didn't feel like lugging this to the hospital. That would have been weird. But, okay, so I got my blood done. I had to pee in a cup. And I was really scared. It really was. For some reason, like, my kidneys were just in my brain really bad. And I've never suffered with like a UTI or a bladder infection, which is the same thing pretty much. And so I was scared. And I get back pain a lot, and this didn't feel like any back pain I've ever experienced ever. So I knew something's a little off. I kept telling people like that, telling people that in my life. I was like, this isn't the normal back pain that I usually get. So I was definitely freaking out and worried about it. So after they did the test, the doctor came in and he came in and told me I have a gnarly bladder infection. So this is the first time I've ever had one, and he explained to me like how people get it and why, and prescribed me some medicine, and I got 2 shots to the head. It burned so bad that I cried. I cried like a baby. I was an actual child. I never knew what lymphedema was until I started watching My 600 Pound Life, and I always told myself, I'm never gonna get to that point. I don't know what I would do if I ever got lymphedema. Like, if you're watching this and you have lymphedema, I'm not like saying anything rude about it. It's just like, it scared me because I've just seen so many sad stories, and it just like broke my heart. And I just never wanted that to be me because of my weight, because it's like I ruined my body and that's like my fault. So every time someone on YouTube would be like, oh, that's her lymphedema, I got hurt by it when it first started happening. And then it started happening so much that I kind of became numb to it, and then I started joking about it myself. But I never had lymphedema, ever. And it was a few months ago, I was getting up off the bed and I felt the bottom of my stomach, and it was lymphedema. I've had time to kind of come to terms with this, so I feel like it's okay to talk about it, but at first it was gut wrenching. And then I think it was about a week later, I noticed it in my right leg. A lot of people have been noticing that my right leg is so much bigger, and it's because I have lymphedema.
It's because I have lymphedema.
Leg's always been bigger. Like, your body is not proportioned like 100% correctly, but now it's just a lot worse.